I'm Eric Davies. I'm one of the bariatric and robotic surgeons at Trinity Health Livingston. I'm really lucky to be able to work with patients every day and see the improvements in their lives after procedures that we do through our clinic. And it's great to see people say thank you and have better relationships and a healthier attitude in life after the surgeries that we do.
My name is Jonker. I'm a bariatric and general surgeon. I work at Trinity. Dr. Davies and I have been working together since 2017. So we see a variety of patients that can be candidates for bariatric surgery. They've tried a lot of other ways to lose weight, and they've gotten to a point where they really need help.
My name is Mike Mitchell. I live in Livingston County. I was in the Air Force from 1978 to 1982, worked crowd control for the first space shuttle landing. I broke my leg there playing ball, and that's when I started to have struggle with weight.
Mike was one of my most memorable patients. He was a fantastic gentleman to get to know in my clinic, and he shared his story about how obesity has been a challenge for him throughout his entire life and how it's worsened over the last several years with his diagnosis with COVID. And since developing COVID, he was given some medications that accelerated his obesity.
They told me that I was so deconditioned and my body was so beat up from COVID that I would never be able to lose the weight on my own. I had my first interview with Dr. Davies. It took me about 10 minutes to realize that I had a blessing.
Before 2017, our county didn't have a surgical treatment option for patients with obesity. So my partner, Dr. Jonker, and I started the robotic bariatric program.
The robotics really allows us to do very precise work in high-risk patients, which a lot of our bariatric patients are.
At our hospital, we provide many different types of bariatric surgery. That includes the sleeve gastrectomy and the gastric bypass. We also perform the duodenal switch, one of the more uncommon bariatric procedures for patients that are higher risk. We also perform a newer version of the duodenal switch called the SADI, or single anastomosis duodenal switch. It's a newer operation, and it's been very successful at our hospital for helping patients treat their obesity.
I went in for my surgery on April 5th. April 11th was my 63rd birthday. I lost almost 15 pounds the first week. Talking to Dr. Davies, and I was telling him how it's only been a week and I felt amazingly better and different already. My wife started to cry. I didn't realize that it wasn't just me that was suffering through the problems I had. It was my wife, it was my kids, it was my grandkids.
The weight loss is kind of what's focused on by a lot of people, but really it's those benefits beyond the weight loss.
Bariatric surgery is the happiest part of medicine. We're taking off medications and off pills and offering people a new lease on life.
If I got a week out of it, I'd take it. If I got 10 minutes out of it, I'd take it. The only thing I would do different is I'd have done it sooner.
I think seeing the patients when they're at that 1-year post-op visit and showing them their picture from pre-op, probably the best.
I love my job. My job doesn't feel like a job. Going to work doesn't feel like work. It's a lot of fun to learn new surgical procedures and do complex procedures to help people get healthier.